mass stretches, lesions, and scars, and then for accessory muscles of inspiration recruitment, right? All right, after we inspect, next we're going to palpate. We start with general palpation. Now, understand that when you palpate a patient, you're going, whatever you've seen that needs to palpate or the area of pain, you're going to palpate by hand, okay? Just to standardize everything for practical purposes, we're going to use certain hand positions that we're going to use for fremitus, okay? So, you'll tell me that you'll explain to your patient you're going to be palpating. Ask the patient if there's any pain or hypersensitivity. What's hypersensitivity? What's it mean if something's hypersensitive?
It's really sensitive.
So, for instance, if you have shingles, the shirt touching the skin may be painful. That's hypersensitive. Does that make sense? Okay? Now, to palpate, this is what we're going to do for the practical. You're going to go 4 spots in the back on our surfaces. 1, 2, 3, and then you're going to cross 4 with palms down. Does that make sense? So we saw that in fremitus in the lecture. Come around front, ask the patient to shield and displace laterally. 1, 2, 3. Palms down. Why are the palms down? Yeah, so you don't touch a female patient's breast. Does that make sense? Okay, so straight forward, right? Turn and face that way. After we palpate, we're going to perform chest expansion. So to perform this, you remember where the thumbs go? What level? Is that T10? Okay, so you can find it with 7 if you want to come down. So we're here. Thumbs, see how the thumbs are together over the spinuses? And then what I want you to do is bring your thenar eminences together. See how you get a little tissue pull? Almost like you're prepping for an adjustment, right? That's going to bring your hands in tight with the ribs. Now I'm going to instruct my patient, take a deep breath for me. See my hands expand there? And go back? That's what we're looking for, chest expansion. Does that make sense? Normal expansion is 2 to 5 inches, okay? So, what does this test tell us? Does it tell us what disease there is? No. This test is just going to tell us if there's unilateral lung pathology. It's not specific, okay? How do we know if there's unilateral lung pathology? Good. So one side either doesn't initiate or lags. So normal would be both sides initiate together, they move symmetrically, right? But if I perform this on him and this hand comes up and this one lags, it tells us there's unilateral lung pathology on the side that doesn't initiate or lags. Does that make sense? So we know there's unilateral pathology here on the left. Okay? All right. Pair up. Dr. DeMack and I will come around and make sure you're doing the expansion correctly.